progress, and that lasts for about an hour. There will be a research in progress. That research in progress lasts for 2 to 3 hours every Monday for 50 weeks. So that is another program that is done. In the research in progress is where individuals who are selected in the program, who are writing grants, can actually present their work and get input from all the faculty that are there and all the other people who are writing grants. To us, it was one of the most productive adjuncts to the seminars. So the weekly seminars give you something to say, how to develop your concept note or your research aims, and then you come in here, present your research aim, and get an input. Because once you can complete that research aim, you can drive the rest of the grant. The second thing is the bi-weekly structured mentoring program. That bi-weekly program is that once you're selected for the program, you are going to be assigned a mentor. That mentor will walk you through on things on the weekly seminar, on things we're doing the week research in progress. It is the responsibility of the scholar to be able to work with their mentors to find a good time for them to meet every other week. And the main thing is there is to see and make sure that the guidance, which again is a strong part of this, a lot of what we do in the program is not lectures. You don't see any lecture here. So we don't do lectures. So for example, we want to look at biosketch. You prepare your biosketch. Everybody prepares the biosketch. Then we ask people to bring up their biosketch. We critique the biosketch, put there, and that would be everybody is working on their biosketch using the critique we are providing to one of them to update their biosketch. And then you can go back to your mentor to say, this is my final biosketch, is that fine? Then before you submit it to the office. There is a dedicated research manager that it will be for this program. So you have a constant communication and contact with that individual. Then there's a monthly research webinar that I talked about. We invite people. So we were scheduled for this February, actually today. We were going to have one of the NIH program officers to talk about implementation science across all the NIH institutes. And once the issues that are going on with the US government are over, we'll have that. And then we'll invite people from each of the institutes, one by one, to come to talk about the funding opportunity that are available to them. The NIH is not usually programmers, so don't do those things for individual universities because it will be over advantage to them. So the reason we work with them is that because NISA is an alliance of more than 12 active universities in Nigeria. And when they come to NISA, they go to visit those universities. The last time they were here, they went to IHVN, they went to University of Abuja. Again, because those ones in Abuja, those are where they could go to visit. They couldn't come down to Enugu or go down to outside of Abuja. But prior years and hopefully things improve in Nigeria, they were in Enugu the last time that we also did things, and they were travel around the country. But in that monthly webinar, we have specific areas we want to make sure that we cover where we don't have expertise in the country or where there's a funding agency that we bring. We are hoping that this coming year, we are going to bring the Canadian and we're going to bring the British as we try to expand this to beyond the NIH. We did start with NIH because I still believe strongly that NIH has one of the most structured grant application process where no matter any grant you submit to NIH, you will receive 3 people doing a review of your proposal. Whether you get scored or didn't get scored, didn't get funded, nothing. You will get this feedback. It was a training for me because in my institution in the US, I was the first person to get my own NIH grant, and those kind of feedback from writing and not getting it, but getting the feedback from 3 people was most of the training that I got. So I think it was a very good way to start. That's why we promote a lot of submission to NIH, not because it is the only funding agency, but because it gives you back reviews from 3 people that helps you improve your project. So we also solicit from for the audience and for the community to say, I want this person. What we can say is that no matter where the person is in the world, we have a way to reach them and ask them to come to present at NISA. And to date, for the past 5 years, we have had 100% success rate with people that we approach to come and present because of when they look at the impact. They look at our webinars that people attend, up to 500 people from many different places in the country. Individuals who are accepted to this program will also have access to the in-person grant writing workshop that we do. It's usually a 2 to 5 days workshop that happens in June of every year. It's in person, it's in Enugu. They will have access to it to be able to come if they, at that point, have a full draft, because for you to be invited to those meetings, you have to have a full draft proposal and you are fine-tuning the final part before submission. We also have the annual research week. People have seen that, where we bring in people from out of the country with expertise, but also bring in people from Africa who have used those things. We talk about frameworks, we talk about designs, we talk about outcome measures. All of those things are research tools, and we bring those tools. We usually bring the people who design the tools, and then bring in people from Africa who have used the tools in their research. And that is one of our very welcomed research week. It usually happens in June, and is a very well attended. And of course, it's an annual conference. Last year, we had people from all the 5 continents being present in Abuja for the conference. We had to stop registration when we hit the 400 mark for a conference that we planned for 250 people. So these are some of the components. And if you have any questions on any of those slides, the best thing I suggest is to put those questions in the Q&A, because when I finish, we're going to go to the Q&A and take them as they arrived and as we receive them. This is a little bit of a breakdown to talk a little bit about what is the topics that will be covered. And you can see the various topics that will be covered. We will go basic and then gradually go from beginning to the end. So you see us talk things like types of grant, the NIH versus non-NIH grant. We go to the NIH grant, the grant.gov, the NIH reporter. How do you find people who have worked? How do you find what they have funded before? How do you find sample of the grant? How do you find people that you can collaborate with? We are going to cover those things in the beginning. And then we go down to, okay, the funding opportunity, you come because you have to have a funding opportunity to be accepted. You have to identify what you're trying to do, identify a funding for which a notice of funding opportunity that you want to respond. It does not have to be NIH. It can be from the Canadian, it can be from the British, it can be from Germany, it can be from anywhere in the world. What we just need is that there's a notice of funding opportunity that is out there that speaks to your own concept. That is how we go, because the singular outcome or measure of success of the program is that you submit your proposal for funding. That is singular. There is no other outcome. It is not a lecture. It is not we'd actually say it is not a capacity building. We say it's a skill building. And the skill set we want to be able to do at the end, and you complete this program, you can say, I can put together a proposal and submit it for international consideration for funding. It is a skill, because once you get that skill, it's just a matter of you submitting as many grants as you have opportunity until you get your grants, and your career is on that pathway. You see us talk about research design, data collection. You see us talk about professional skills. Professional skills is a very important part of something that it has not been here, that is added to this team. Part of that is communication science. We talk about how to communicate your science, how to communicate to lay people, how to communicate when you give interviews, how to communicate through abstract, how to communicate through manuscripts. So all of those things will be things that are also there for us to be able to do that. You also see where we talked about plagiarism, talking about the importance. People get into trouble with that because sometimes we are not, because sometimes we have to be conscious that certain behaviors have consequences. And when they pull your article or your grant from POSA because you plagiarize another paper or another project, is something that you will not like. And one of the things you see us do, if you're accepted for this program, will be that you will sign a guarantee that people are going to present their ideas in the workshop, and that you respect those intellectual things. Find your own idea. Don't steal people's idea because they presented it to you or they gave it to you. It's something that we don't do as faculty. Any faculty member that's working a mentee, do not take the idea from the mentee and go to submit it. They have that capacity to do it, to take it and go submit it, but they don't. Not because they can't, but because they choose not to. So we ask people to stay away from plagiarism, stay away from taking people's ideas, develop your ideas. This is what we are presenting for you, a platform to develop those your ideas and turn it to a proposal that you'll be very, very proud of what you've done. So these are common things. If you ask any question, there we talk about budget, how to build your budget. We talk about teamwork and leadership, including conflict resolution in terms of teams when it comes, but also how to choose those teams. Because sometimes people think, okay, I want to write something on the pediatrics, and I'm a pediatrician, so I'm going to get 7 of my friends who are pediatricians to write a grant. That's not how it works. A grant is a multidisciplinary team. So you have somebody from pediatrics, yes. You have somebody from cardiology because you're writing something on cardiology, yes. You have someone um, from biostatistics because you need one. You have somebody from the social sciences because you need the qualitative part. You have somebody from implementation science because so it is a multidisciplinary team that is there that you need, and that's something that we are going to cover all of these areas during those times. So some of them will be covered during the one hour work seminars. Some of them will be covered during the research in progress. Some of them will be covered during the monthly webinars. Some of them will be covered during the research week. Some of them will be covered during the conference. So you can see it's a huge amount of things that are covered, but they are all practical. If you don't have a laptop, don't have access to the internet, you can't complete this program. If you don't have the time, you can't complete this program. We have had cohorts of people who have completed this program. Usually in a year, we get about 100 applications from all over the country and outside of the country from other African countries. We pay attention very closely to this to make sure that people complete that. Remember that one of the main outcomes that we want is for people to go ahead to submit their proposal, help them develop their proposal, help them form the team they need, help them in terms of the budget and things like that. So we have people who have worked on budget. We have a full office of research administration and that supports anybody that is applying for a grant. You can apply for the grant from your institution. That's not if you don't have an institution that is capable of doing it, you can apply it to Ivan, and we support that. And it is your project. You'll be the PI for your grant. The idea that if you come to that. So those are the things that our job is to make sure that you get the support you need, you get the mentoring that you need to be able to get to the final stop. And the final stop here is submitting the grants. So that's what we want to be able to do. So who is eligible for this? And then that is something that I think is important for anyone from any region of the countries. Southeast, Southwest, South, Northeast, North Central, Northwest. If you are from any, and if you're from any of the African countries and you don't have those opportunities in your countries, this is a platform that is also available for you, that we are going to be able to do that. We do want people to have advanced degree. Previously, we had those to be terminal degrees or professional degrees only, where you have to have a PhD or an MBBS or a pharmacist or I'm trying to figure a veterinary doctor or someone that had this professional degree or a PhD. But this year we thought we would do something different. We actually say advanced degree, which means we will look at people who have a master's degree, who may be doing their PhD, because we found out when we thought that a lot of people actually use this opportunity to develop the thing and then use the same thing they use for their PhD project as the grant. Because why, if you had a good idea that you use for a PhD project, why can't you use that for a grant proposal? So we will look for people who have a master's degree, who have very good proposals. Again, the idea there is preferably that you have a terminal degree, and then that is there. You have to have a concept. So you have to have a concept. So one page is one page concept of a specific aim. You have to submit that is feasible, that is culturally adapted, that is sustainable, that is have transformational outcome. What we call a fast concept and idea. The fast standing for the acronym that I just put in there. then you must ask yourself, do I have time? So you may be, everything may be there, but if you are the CMD of your hospital, well, this may not be a good time for you. Maybe after your CMD and you want to do it there, that's fine. We don't have restrictions, whether you're early career, mid career, advanced career, because we also understand that there are people who are professors who have not done research or want to take their research to another level. So this is open for assistant professors, associate professors, full professors, whoever you are, as long as you have a good idea, as long as you live in Nigeria or you live in any of the African countries, or even if you're outside of the country and you want to be able to do that, those are the ones that we will give you less preference because we know that in the US or Canada you have other opportunities, and also because we do run a program like this in the US for US based faculty. So that is a different thing because in those ones they all meet in physically in Las Vegas once a year, where we do the same thing that we do here, but those are directed for the faculty that live there, again because of the time differences that happens. So who are we looking for? We are looking for doctors, we are looking for nurses, we are looking for pharmacists, we are looking for social scientists, we are looking for health economics, we are looking for communication specialists, we are looking for health public health physicians, or whatever discipline that you have had an advanced degree and you have a good idea for research. We are not a program grant, so we usually don't write programs grant, but the research grants are usually built out of program. So if you are working in any of the IPs and you have an idea that in that place, this is also for you to be able to say, this is what we do as program. How can we convert those program things that we've done into questions that we have raised? How can we answer those questions? So I've been working with key population for a period of time. And there is a question that has been really bugging my mind, and I wanted to see. I have an idea that I think will make that key population programming better, but I need to test whether it will work. That's where your research comes in. Most research come in from program. In fact, the type of research we do, these are not basic sciences where we're trying to find vaccines for this. These are mostly public health interventions, general things to answer your questions. So most of them come from either when you are seeing patient and you say, well, I have a lot of people I've been seeing recently with kidney disease, and I'm wondering whether this kidney disease is related to borehole water that we have in the country. And I want to be able to test the borehole waters to see whether they contain something that is toxic to the kidney. Or maybe there's rising diabetes, and they've seen a literature that cadmium is one of the heavy metals that can cause diabetes. And I wonder whether these things are more prevalent in our drinking water because we are increasingly using boreholes where we dig through the ground where these heavy metals are. So I want to be able to do a research project to be able to collect waters from all the 6 regions of the country and be able to test those. Those are some ideas, beautiful ideas, because again, we are not looking for you to do a research in one place in Ibadan or one place in Enugu or one place in Kano. No, we want you to look at a national multi-center trials, and that's why the infrastructure of that country is there, where we have sites at all the 6 regions of the country, 2 sites in all the regions of the country. So whether you are working as a qualitative researcher with a PhD in public health education, or you're working as a sociologist who is interested in looking at how health interventions improve health outcomes, bring your expertise to the table and let's help you develop that. The last thing I want to talk about is that for the past 3 cohorts that we've done, we actually did those things for free. We think we're still doing it for free, but the team came up with some idea. We actually want to be able to have people pay for it. The reason we felt that is that over time we find out that there are some people who actually pay attention to this and complete them. And when people start it and get to the midway and stop, we lose a lot of time that we have spent on those people. So we want people who actually want time. And the majority, when we looked at people who have gone out of it, they say, oh, I just didn't have time for it. I wanted to do it. I really wanted to do it, but I don't have time for it. So we really want people to think about it, consider about it. It's not a lot of money. It doesn't cover anything. And we have scholarships available for submitted proposals. So this is one of those things you can You have to pay for those things so that you make sure that those hours that you're supposed to be there, you will be there. And if you end up submitting your proposal, you may get that scholarship where you actually get those fundings all back to you. But the whole idea about this costing for us is to make people think a little bit about, yeah, again, if you have a bright idea, focus on the idea itself. Send your best idea, send the things. If you're selected for it, there are those things that we discussed about. What we talked about in the last thing here is that individuals who successfully complete the program, which means they submit a multi-year proposal, we're not saying that they have to be funded. No, that's not the criteria for success for us. That is an icing of the cake. I submit grants. I don't get all the grants that I apply for, but I think I'm very good at being able to put proposals together. So I don't think judging people by how many they get funded is there. We judge people by, did you complete this and submit? Because you know that you are 100% sure that you will not get a grant you did not submit. That doesn't magic where you can go to church or mosque or wherever you go and pray all day. You're not going to get a grant you didn't submit. So yes, God will do what God does best, which is getting you the grant. That's not our job. Our job is that you submit the grant, because we know that if you don't submit the grant, 100% you are not going to get it. So individuals who successfully complete this program and submit a multi-year proposal will join the team as faculty. So next year, you will see those people who have completed this and submitted the grants as part of our faculty. Why is that important? Because these are people who have gone through the program and actually did it, so that they can help people work them. Say, I myself started, this is how I was able to do that. So they become mentors and be able to help advance people to the project. And people can say, when you submitted your grant, I'm having problem with putting a team together. How did you put a team together? Those mentors can help you work on those things. So like I mentioned, this is 30 minutes past the hour, and I want to change this over to questions. And we are going to go to the questions. As we move to the questions, I'm going to introduce some of the team members that are here and the faculty members that have been part of these cohorts over time along the way. Our Ctair Scholar Program is anchored in one of the centers in Ivan. Ivan has 5 different centers, and one of the centers, the Center for Translation and Implementation Research, it is where we anchor that, and that program is led by Tonya Onyeka. Tonya Onyeka is a professor of anesthesiology, pain management, and palliative care at the University of Nigeria. She also leads a lot of our scientific work with the other teams at the Nigerian Implementation Science Alliance. So she's here. Another person is Dr. Olawepo. Dr. Olawepo also leads a center at the Ivan Research Institute, the Center for Strategic Integration. He's also an associate professor at Northeastern University in Boston, United States. You also have Stephanie Ibemere. Stephanie Ibemere is a nurse scholar. She is a trained nurse with a PhD in nursing, and she also leads the Center for Nursing Evidence-Based Center at our institute. She's at Duke University in North Carolina. You also have Dr. Lakunde. Dr. Lakunde, most of you may have known, was at NACA for more than 10 years. And also runs the center at our institute that is also Sunrise Oncology Applied Research. He is an assistant professor at University in Texas. You also have Dr. Aronu. Dr. Aronu is a social scientist who is our associate director for operations and grants, and she is an associate professor at the University of Nigeria, Department of Sociology and Anthropology. So you do have a core advanced team that are here. You do have other team members, I don't know how many of them that are here, that also are people who have, again, we selected people who have had a grant, who have had experience, and we keep expanding that faculty mentor base. So if you know anyone that is interested in becoming a faculty or becoming a mentor, please let us know. Professor Chibu is a Ghanaian oncologist. He also does have an NIH grant, and is one of our mentors and faculty on this. He is a multiple PI with one of the grant, that we receive from NIH to integrate uh, professional capacities into these technical skills. We have Dr. Lasha Bikan, who before now was the director of oncology at the University of Nigerian Teaching Hospital, but now is in charge of research at NICRAT, the National Institute of National NICRAT stands for National Center for Oncology Research. I forgot what the
Yeah, the
treatment.
cancer research.
Cancer Research and Treatment. Okay, of the federal government. Okay, that's good. We have Dr. Tani. Dr. Tani is now completing her PhD in data science and in Canada. We have Professor Dim. Professor Dim is an obstetrician. All of these people I mentioned all have NIH grants, which is why they are part of the faculty, and we're able to provide mentoring to people in different stages there. Whether it is, we're expanding that pool. So again, how do we expand the pool? Two ways. If you have someone that have a major grant that want to give back to the community, the NISA infrastructure through this CITA program is a platform for them to do that and give back to there. We do that irrespective of which part of the country you come in, which university that you're attached to, or which part of the African country you come in. We really don't care. What we care about is your idea and your commitment to improve yourself. And this is more of people we believe that God has given and want to give back. So anyone that have also successfully getting their project and wants to give back. We want to have a structured platform to do it, a sustainable platform to do it. This is not dependent on funding. We've done this for 4 times, just like Nigerian Implementation Science Alliance. We don't think funding is the way to. Funding helps you achieve things. But funding does not mean that once funding is end, the project to end. Any project that ends with the funding wasn't designed well. So most of the time when we started the Nigerian Information Science Alliance, we didn't ask for funding. We didn't want funding at the time. We wanted to settle down very well. Since we have stabilized it very well, we have received funding from NIH, from different places to continue to do specific work. But those fundings should not be what forms your foundation. So that you start, then the funding ends, then all the 5 years, 10 years you've spent goes away. So this particular thing that we have many D43s, which are training grants in Nigeria. At least there are 5 of them given to different universities in Nigeria to be able to provide one. They do an excellent work. Some of them actually train people for the PhD. So they give them the capacity that they need. What we're trying to do here is after you have gotten that your PhD, after you've gotten those things, after you've trained in those training programs for 1 year, for 2 years, for 3 years, but you still need help to go to the final stage. So this is the last mile of your academic career, is how do you submit the grant? That's what we do here. So come with your ideas, come with an identified funding opportunity you want to respond. Come with a passion in your mind that you want to do this. Come with a dedication in your time that you said, I want to spend the time to do this. So thank you, everyone. And I'm going to hand this over to Professor Nyeka to come up with questions. And if there are questions that I think we need additional team members to respond, I will call on them to respond. So Professor Nyeka, over to you, and we can move to the Q&A question. Thank you.
Yeah, thank you so much, Prof. Thank you, sir. Welcome, everyone. The first question is, someone is saying, I'm currently doing an MPH program, and I anticipate to complete the program by the middle of this year. Can I still go forward with the application?
So the answer is yes. If you do have a good idea, this is the first year that we are opening it up to individuals with masters. You still have to meet the other criteria. You still have to have a concept, or you still have to have an identified funding opportunity that you want to respond to. Remember, we have a singular outcome. We want you to submit your proposal for consideration for funding. So you have to have those two things. But this is the first year that we're opening it up for people, individuals with masters. Prior years has been that you must have a PhD or a terminal degree. But yes.
Yeah. So the next
I hope that
question
was the point.
says, is this, yes, the next question says, is this program free of charge? So I guess the person is just joining. It says, is this program free of charge, or is there an application fee?
There is actually no application fee. It is free for you to apply for. However, we did say in this, and I want to bring back that slide so that we can all see it again. And this is from our experience over the last three cohort. We do have, once you're accepted in those places, we do have a $10 per month for you to continue those programs. If you become one of those who successfully submit these proposals, because we want people to actually pay attention to this. We spend a lot of time on this, a lot of commitment for a whole year for free. So we want people to actually take it serious. So that $10 is a way of your seriousness commitment. So we don't call it a cost, but it is a cost because it's money. So we want you to be able to do that. But if you submit your proposal, that first time proposal submit that, you actually might have a scholarship that covers that. So that is the cost of it. There are no costs to apply. So if you have an idea, you have a thing, please apply. I encourage you to apply. If you're selected, then this is where we will go into discussions about that $10 per month. All of you know that for the things that I described here, $10 per month isn't a charge, but we want a commitment. That is a commitment to say, I commit to this. I am going to spend this 1 year. I want to make sure that I make out the time to actually pay attention to this, because it's like training people. We do this for 12 and then they drop off and they don't follow through with this. It's painful for us because it's time that we could have spent with our family. Remember, the major drive for most of the faculty, all of the faculty, not most of the faculty, is they want to give back. They're trying to find an organized way for them to give back. These are people who have done their own grants. They don't need to do these programs, but they feel like I benefited from somebody doing this for me. I want to do it back. So that's the only cost that is associated with this. That is there for you. But there are no application costs at all. It's free for you to apply. It's only when you're selected that we want that commitment. We call it commitment deposit for you to pay attention. Thank you.
Okay, thank you, sir. So this is another question from Dr. Maureen. She's asking, could we be given the link to available grant opportunities? That would encourage us to write the proposals. Most times, I don't know when the grant opportunities are available. So she's talking about having links to maybe the funders and their funding opportunities.
Yes, there are many of them. We will have those as part of the monthly webinar that will occur. Again, that's one of the things, like I said, we had invited the NIH to speak to us today. But because of the change in government in the US, the communication with the US government has been closed. We're hoping that that reopens this week. But what we would have had today wouldn't actually have been this overview. What you have today would have been NIH telling you about research grants and opportunities in that. But it's simple. There are major ones. You go to, if you go to Google, so this is, they say, don't do for a man what a man must do for himself. If you're passionate and you are looking for this, go to the internet, Google. Just Google funding opportunities for countries in Africa, for low and middle income countries. Go to nihgrants.gov. Go to, so we can also, while we're doing this, Dr. Osonyeka, one of the team members, can put in the link to nihgrants.gov, put in the link to the British one, put in the link to the Canadian one. Those are three major grant funding agencies, but there are so many other ones. Bill Gates Foundation, there's the WHO, there are so many other ones. So I would say this is part of your commitment to actually look for that funding opportunity. That's why we ask that people come to the application with a proposal. So go in. If you can't do that work, then I don't think you can complete this program. So I think you need to, first of all, say, this is the idea that I have. I'm looking for the funding. Look at what our job is now to help you fine-tune that proposal and get it to where you can submit it. But we need you to do that work. That is part of our first thing to see, that you go out and look for that grant. But yes, can we help you? Yes. Another place that we can also help you is to go to our website at avaninstitute.org. We are going to be putting in the list and link to funding opportunity at our website. You also can go to the Nigerian Implementation Science Alliance website, nisaresearch.org. We are going to be putting in links for proposals that have come out there. The best way to do proposals is to look for proposals, and we'll talk about this down the road in the monthly webinars, is look for proposals that have multi-year, so that if you see it and it's due for next 2 months, you may not be ready for it, but it's like it comes again after, like for example, NIH grant, a lot of them comes out 3 times a year. February 7, June 7, September 7. So that if you see it in January, you can say, okay, I'm going to prepare for the one in September. So you give yourself a time to prepare for it. Or some of them actually run multi-year for 5 years. So 3 times every year for 5 years. You can say, okay, I'm going to prepare for this for next year when I'm going to submit. So I can go through this program and prepare a good proposal that I'll submit next year. So the job is you have to do that job. Your commitment is your responsibility. So you have to go in, look at the proposals, the kind of opportunity that is there. That is your own responsibility. Be able to identify those that matches your things. But during the Monday webinars, we are going to talk about, things that will help you. For example, we will talk about your biosketch and how you match your biosketch to funding opportunity. Those will be available to everyone, not only ones who are selected to this program. Again, so that, hey, maybe this is the first time you're hearing about this program. You want to join and then get benefit of the monthly one that happened, so that you're ready, so that when we go to cohort 5, you will apply for cohort 5. So again, those we did that last year. Every month we did that, and this year we're going to do that again. Every year we repeat the same things. Those are basic things that help you. How do you do your biosketch? How do you find funding opportunity? How do you read funding opportunity? Those things you get irrespective of whether you're in this program, because we know that sometimes people need that before they can apply. So if you don't have a way for you to look for proposal, and you say, I don't know where to start, then that means you're not ready for this cohort. You can apply, you can see what we do for the Mondays, see how to do that, search for that, and then apply for next cohort. Thank you.
Thank you. Okay, so someone is asking if uh they will get, say some of them are very green. Say some of us are very green in acquiring funding and research grants. Is it possible to acquire this knowledge in simple terms at the shortest possible time without being frustrated in the long run? So I guess this person hasn't done anything on research funding or research grants. Do you think this is a good program for that individual?
So this is a good program, not the scholar program for it's about the whole platform that I described there, offered by the Nigerian Implementation Science Alliance. Remember, I said there, I think there is a Monday webinar. Register for it, it's free. And we talk about those things. There are 3 things. If you look at the flyer that I hope that you saw that brought you to this program, I can see there are more than 200 people here, and this is also doing live
YouTube.
on the on YouTube. So there are
On
other people that
YouTube
are there.
channel.
But what we're doing, what is here is that you can actually follow those things and see that opportunity. But there are 3 things that we said on that flyer. The best investment is investment on yourself. If you finish a PhD and you don't know any of these things, you should ask yourself, why did I pay those people for my PhD? Truly. Because the PhD is not your first degree. It means you have done a bachelor's, you've done a master's, you've done a PhD, and nobody taught you anything about how to write grant, how to develop a proposal. How did you get a PhD? So I believe that anyone who have done a good PhD and completed must have done a PhD project, not a master's project, not a bachelor's project, which they have done. So they've done a bachelor's project, they've done a master's project, they've done a PhD project. Those people can put proposals together. So you shouldn't be green. Anybody that had a PhD and say, I'm green, I I I worry about the PhD that they have. And I'm saying it in good faith, not because of the person, but because of the institution that gave them the PhD. Every institution should prepare a faculty member to be able to teach. After all, when you are doing PhD, you have to be able to do proposal development, because you have to have a proposal for your PhD. So my belief is that everyone who have a PhD have had the proposal before. That's how they got a PhD. So it's the same way you got that PhD that you are going to now use it and fine tune it. That's what we're doing. So that's initially why we restricted this to PhD people, because you must have done a PhD project, and it won't be your first, it will be a third one, because you have done one for your bachelor's, you have done one for your master's, you have done the last one for your PhD. What we're trying to do is to be able to put your idea the same way you put a concept for your PhD. Put a concept, come to us, and then we help you to move that there. So I don't think may not be as green as you think you are. No. The second thing is that the self-improvement. You have to. In these days and age, the internet is there. If you go to the internet and instead of watching, what the president of America says and what the president of Nigeria said. To be honest with you, they're not going to help you. They're going to be doing their politics. Why don't you pay attention? Just go to YouTube and say how to write a grant. You will see YouTube things from NIH, from British government, from on how to, because they are looking for ideas. They are looking for your ideas to submit them. That's how they have made a commitment to look for the best ideas to fund. Spend the time with those YouTube instead of the Facebooks. Sorry, I have nothing against Facebook, but I think it's a waste of time for a lot of people in our continent that goes there and scroll and scroll and scroll and scroll. Free speech. So this is my personal opinion. I think you stay away from those Facebook, unless when you want to relax, and then you can go there and relax and see what the gossip is all about. But spend more time on yourself and go to the internet. Use the internet for what it's supposed to be: knowledge building. See, if you go to the internet, you can see funded project, different kind of funded project. So there are things you can do yourself. You are not as green as you think you are. It's just that you haven't spent time on yourself. Take time on yourself and say, this is where I want to go to. Your first spot should be Google. I like Google a lot because you can Google anything. How to write grants. There are tons of videos. Watch them. Put them in your nails. If you're driving to work, put them in. If you're at work, break time, put them in your walkie-talkie, whatever. Listen to them. That time spent is better than 2 hours spent scrolling Facebook to see who bought a new car and who is streaming, and those are good social life, but invest some time on yourself. You will find one thing. I'm telling you, you're not as green as you think.
Yeah, right, sure. If someone is asking, will they get the outline for the proposal? Remember, they're supposed to submit, interested participants should submit a one-page proposal. So someone's asking about an outline for that proposal.
Yes, there will be, when you go back to the website, there will be an outline that is there before the proposal that is done for you to do. But you can also put it there, how to write a concept note. We want you to do some work because that is part of how we see people who are committed. Go to Google to say how to write a concept note. We will accept it in any form that you see there. It can be a specific M if you're writing for NIH or some of it. It can be a concept note if you're writing for WHO. So look, that's why you need to find out if you find out the funding opportunity, I guarantee you that funding opportunity will tell you how to write that first page, which in some places is called a concept note, in other places it's called a specific M page. But remember what I said, your commitment is your responsibility. So that is the first part of what we want you to do, because in doing that, we know that this person, that's how we evaluate those people that we select from, is to say this person has made out the time to invest in themselves. They've gone and they've done what no man should do for them, which is get interested, this is your own commitment. So bring it the way it is. Bring that idea that you have. So that we don't want to restrict that, but we might have some concept ideas on the website that are also, if you can find them in Google, which I think, it's a lot more there than we have on our website, but that will give you a way to do it. So we really don't want to restrict you, but it has to be one page.
Okay, so Prof, before you answer this question, I'd like to answer one question. And some people are asking for access to the application link. So we'll be sharing that link on the chat shortly. So the next question, sir, is Dr. Halima is asking, can I use my concept for my MD program for this Ctair Scholar program?
Absolutely. That's the way that we can use the one for your master's. You can use the one for your PhD. You can use the one for your primary part one, the one for your part two, or the one that, so you can use any idea that you have dreamt of and saying, I wish I could turn this into there. Remember what our role is. Our role is, because we have done this, we have been successful doing this. This has been out of success. I have been opportuned to be a reviewer for NIH for 10 years. Those experiences something I value, and very grateful to the National Institute of Health in the US, because I can understand what they're looking for. That is not any inside information. It is things NIH say on their own training program. Because NIH wants you to submit good ideas. They want to fund good ideas. That's their role. That's their job. That's why they have a job. They have a job because they're looking for people with good ideas that they can support so that the world will be a better place. So those ideas is what we are bringing to you. because not everybody can go to the US to do those things. Not everybody can afford to go to the workshop that costs you money. So this is a commitment from those who we believe have been blessed enough to give back and give it back free, and be able to do this. So we want to help you push through those things to be able to do that. So any idea you feel that you think is a good idea, the only thing that we're saying is that you do some work, which we said commitment is your responsibility. Find a funding opportunity that is looking for the idea that you have and bring them. And then we will help you work through that proposal to get it to a fundable state and submit it to that funding idea.
Okay, someone else is asking, how do we get the Monday webinar link to attend the webinars?
The Monday webinar link is everywhere. Follow me on LinkedIn if you have a LinkedIn. So maybe you should think about it in addition to your Facebook and then the other ones. Have a LinkedIn page. Follow me on LinkedIn. It's always there. Follow the NISA LinkedIn page is always there. So it's the two places that you're gonna see it, and people share it very widely. Just like I don't know how you got this one, but it will be on my LinkedIn page. It will be on NISA LinkedIn page. Those are two places that you're going to see, and people are going to be sharing. Now we encourage people to share it more. So those Mondays, you always see it before the month. It is the first Monday of the month. So you see those monthly webinars, and Professor Nyaka takes charge of that for our team, and then she does an excellent work. I want to tell you that all the flyers that you see, she has worked with our data team and our IT team to develop them. But all of those colorful, each month I mean, the commitment she brings to this is something exceptional. She makes those things, flyers themselves, sometimes multiple times to get the pictures, get even to invite one person from NIH. There's a lot of work on the background that you don't see that we have to do. Plan it, make sure that the person understands what our audience is and what we are looking for, and get it. And we are so grateful to a lot of people that accept and come. Which is something that have, because when they come, they say, well, I enjoyed my time. They tell other people, and when we approach them, like I said, we have 100% acceptance of people who have approached to do. And if you have an idea of somebody that you think we should invite, please let us know. I will invite them to speak. But that Monday webinar is go on LinkedIn, type my name, you will see my name, or type the Nigerian Implementation Science Alliance, and you can also follow Nigerian Implementation Science and follow me on LinkedIn. You will see those two things.
Okay, the last question here says, Prof, does it mean anybody writing proposal can send a prelim write-up to Ctair for review, ideas, and corrections? If yes, how do we do such? What's the submission route?
The one page. We don't want to see your proposal. We just want a one page of your concept. And if you're selected for this, that we have those. For in terms of reviewing people who have that, we have a different program. We do with that is not free. But we have proposal review. We do a lot of things from our team. This particular one, the Ctair Scholar we're talking about, is our free program. We do have a program where if you have a grant you have written completely and you wanted a review for a fee, the team does that. We don't get involved in your project, but we review that and give you a feedback. We do that for a completed proposal that you've written. So you are someone that knows how to write those things, you've written them, but you need professional review. We do that. And these are from people who have both been in reviews and people who have actually written their own grants and got them and also have done that. So we can do those, but those things, that is not this program. We also have a team that also can be involved in your research. We have people in Nigeria who have grants, from large grants, and they've been kind enough to ask us to say, we want your team to join us to provide the implementation science expertise that we need for this grant. And we have joined them. You don't see our name because it's not our grant, it's their grant. So it's their grant, but they recognize that instead of going out there to look at what they are looking for outside of Nigeria is available in Nigeria. So that's what we're trying to do. And they come to us and say, can you do that? Yes, we're in Nigeria, but we do have national and global expertise. And we have competed everywhere else. As most of you know, I was in the US for 25 years as a tenured professor. So that is not a limitation to those expertise. But what we're trying to say is that can we improve the capacity and skills of Africans to be able to be competitive in the world? This is our small part of the solution. There are so many people doing the same thing in business, doing the same thing in technology, doing something. This is just us bringing part of the solution for the science, and health people. So depending on what you need, we will provide some of those things. Whether to say I'm writing a grant and involve some implementation, I don't have an expertise in that. Will your team provide that expertise so that I can have you on the grant? Yes. I have a grant proposal that I think, can your team review those grants? Yes. I have this thing. Can your team organize a specific workshop for our group? Yes. Can your team do a workshop for our group? Yes. But those things are not this one. Those other ones I mentioned, they are not free. But this particular one is our free program to everybody that wants to do it.
Okay, so then finally, can you speak to participants on this webinar who are joining from outside of Nigeria? Because as you know, we've had scholars from Kenya, we've had applicants, we've had scholars who have Ctair scholars certified from Kenya, we've had applicants from Tanzania, Uganda, and we have actually some Tanzanians on the call right now. So what advice would you give them? They're interested, they want to apply.
But it's nothing different. What we say is come how you are from wherever you come from. As you can see on the slide as you're looking at it, it says all regions of Nigeria, all African countries. We do not separate any of those. What we are looking for is ideas. Bring your idea, bring in your proposal, funding opportunity you want to respond to, and let's work together to get you there. So it is the same thing whether you're from Tanzania, you're from Nigeria, you're from South Africa, you're from Kenya, you're from Malawi. We will do the same thing for you as we do for all the part of Nigeria. So the reason we put in all regions of Nigeria is first of all, this is not a regional Southeast program or South program now. We don't care where you come from, where you live. All we care that you're an African man or woman. Whatever country you're coming from. The only thing that we third African countries that our time for the conference, Nigerian time is used to do, or West African time is used for that, and that's because we have people from all the 5 continents who are part of faculty, and so we pick one time zone in Africa to do that, and we use the West African time zone. That is the only difference for you, is to see the times that will happen. Like this particular time, does it work for you? Does later in the evening work for you? Because when we select the team, we work with the team to pick the time that is best for them. And then that's what we take with the team. It may not be best for everyone. Some people will make more sacrifice, but because we have people, we have people from, from our collaborations in Australia, from Melbourne, joining our conferences and speaking at these conferences. And it's 2 a.m. in Australia when they join us. But they've made those commitments and they have done it multiple times. So that is the only difference. But wherever you are from African countries, all that we ask is 2 things. Do you meet the criteria, which means you have an advanced degree? Do you have a concept? Do you have the time to do this? That's all. We don't we collect information where you come from just so that we can see the people that we serve, but otherwise it has no impact in your selection.
Thank you so much. Thank you, Prof. Thank you everyone for joining. And if you go to the chat, you can find the link to the application form for the cohort we'll be selecting this year. And please spread the word, share the information, and you can always reach us back at our email, admin@ivaninstitute.org. Please reach out to us with your questions, and of course, we'll answer as quickly as we can. Thank you so much for attending the webinar today. And yes.
I see one last question there. Is saying,
okay,
are Nigerians outside of Africa eligible to apply? The answer is yes. Again, if you live in those places, we do have a different program in the US. It looks exactly like this, but it's different. Our center, where we have our things and all, is coming from the US. So that is, and our in-person meeting is in Las Vegas. So you have to consider for yourself, if you're outside of Nigeria, whether it's for you to be part of that particular one or to be part of this one. So again, because of the time zone differences, but you can apply for that. He said, what are the requirements to be a member of NISA or the Advanced Research Institute? The NISA has 2 membership categories. One category is where if you work for an institution, institutional category. So IHVN, APIN, AQs, they are all founding members of NISA, so they are institutional members. We do have an individual member for NISA, and that is going to be on our website this month, on NISA website, nisaresearch.org. And then the criteria for you to be an individual member and the benefit that it gives you for being an individual member, including reduced cost for registration for the annual conference that happens in Abuja every year. This is our 10th year, and it's going to be happening again in September, September 2012, and most likely going to happen at the Abuja Continental Hotel. So if you want to plan for it, you plan for it. I think those are the three that I saw that were open questions, and I think I have answered them. And thank you, everyone. I joined Professor Nyeka to say thank you so much for listening to this. And as you notice, we try to make this keep the time. Start when we say we'll start. Stop when we say
Yeah.
we'll stop. So this is 8:05, 5 minutes after the hour. So thank you, everyone.
Thank you, everyone. So go to the chat. Yes, you're an NGO, you're eligible, you have to have a master's or PhD. Go to the chat, see our email, send us emails. If you want to be a NISA member, send us an email, we'll give you the information. Thank you for attending, and bye-bye.
So you can keep the line on so that the team can capture if there are things on the chat. And I hope so. If anything, personally, I can just don't cut it yet so that if there are chats
Yeah, we're
that people
waiting.
put in there, we can cut that before we cut. So give another 5 minutes for people to.
Okay, sir.
And so if there are contact information that they need, yes.
Yes, we'll send them out. Okay. Thank you, Dr. Bengu.